I'm third, which, you know, third means totally not special. I have an older brother and an older sister and 4 younger sisters. I know more about women than I want to. But growing up, my dad called me a maverick, because going like how everybody else went just wasn't my thing. And when he called me a maverick, it was clearly to him not a good thing. Does anybody else grow up like that, where you're not fitting quite right? If we forward to 1972, that's when the draft was still going on, and they drafted you with a lottery number. So they put all of our birthdays into the hopper, and they pulled them out. July 19th was 19, which meant, bye, see you later. I hope you like green. And I became an infantry medic, which is where my love of medicine was born. But shortly after, doing maneuvers with infantry soldiers, I learned something about myself. I don't like sleeping in the mud. And the idea of being shot at, I just didn't like it. And so I'm fairly bright, and I figured out how to get myself retrained as an X-ray technician. And I love that. And our professors used to always say, how do you know unless you look? And so that's when my love of imaging was born. So imaging and medicine. So fast forward to 1979. I'm now a second-year medical student at Oral Roberts University. I just got married to my childhood sweetheart, who, when I was 18 and got sent off to Europe, we broke apart. She ended up marrying someone else who abused her. And when I got into medical school, I called her mother, who was a special person to me, to tell her I'd gotten into medical school. And I found out that my sweetheart had been separated. And you never love anybody like your first love. It's very special. Of course, and then until you marry them. And then you realize that your memory wasn't quite as good as you thought it was. 2 months after we got married, she tried to kill herself. And I'm frightened and horrified and bring her to the chief of the Department of Psychiatry at Oral Roberts University, and I fell in love with him. Why? Because I realized that if he helped her, which he did, it would not only help her, it would help me, and it would help our children, and subsequently even our grandchildren. So I fell in love with psychiatry because I realized it was a very special profession that had the ability to change generations of people. So I'm passionate about what I do. So if we fast forward to 1991, I go to my first lecture on brain SPECT imaging. SPECT is a nuclear medicine study that looks at blood flow and metabolism. Dr. Jack Paldy, he's the one that gave the lecture, he said that SPECT is a tool to help psychiatrists get more information on their patients so they can make better decisions. And I'm sort of excited about that because in that one lecture, my 2 professional loves, which was imaging and psychiatry, came together and quite honestly revolutionized my life. Over the next 23 years, my colleagues and I would build the world's largest database of brain scans related to behavior, now over 87,000 scans on people from 111 countries. So we're really excited about combining imaging for psychiatric issues. On the screen, you see 2 SPECT scans. This is a healthy scan. SPECT basically tells you 3 things. So it tells you areas of the brain that work well, areas of the brain that are low in activity, and areas of the brain that are high in activity. Got that? So good activity, too little, or too much. The image on the left shows the outside surface. Now these are blood flow maps of the brain, if you will. Healthy scan, full, even, symmetrical activity. Color doesn't matter, it's the shape. The image on the right, blue is average activity, red is the most active parts of the brain, which are typically in the back bottom part of the brain. Why? Cerebellum has half the brain's neurons. Okay? So here's an image of a healthy scan versus someone who had 2 strokes. So it's not that hard to see, right? The holes are areas of severe decreased blood flow in the brain. Here's an image of someone who has Alzheimer's disease, where the back half of the brain is deteriorated. Now, the thing that is really upsetting when you understand imaging in Alzheimer's disease is Alzheimer's disease starts in your brain 30 to 50 years before you have any symptoms. So this person, who I'm showing you, she was diagnosed with Alzheimer's disease at the age of 59. That means that her brain was likely deteriorating in her 20s. So those of you that are waiting to get serious about your health, because you don't want to get Alzheimer's disease, now would be a really good time to start. Those of you that think you're going to get well after you lose your memory, forget it. Because by the time you lose your memory, it's not early in the illness, it is late in the illness. Here's an image of someone who had brain trauma. Your brain is soft, about the consistency of soft butter. Your skull is really hard. Your skull has many sharp, bony ridges. Mild traumatic brain injury, as you'll see, is a significant cause of psychiatric illness, and virtually nobody knows it because very few people ever look at the brain. This is what drug abuse looks like. When I first did imaging, I was the director of a dual diagnosis unit. It's a psychiatric hospital unit that takes care of drug addicts, and their brains just look so awful. And after about the 15th patient who had an awful-looking brain, I started collecting them, and I took them home to my 4 children. And I effectively induced anxiety disorders in all 4 of them when it came to drug abuse. And on their mom's side was a very severe history of alcoholism. And I'm like, if you never drink, you're never going to have a problem. If you drink, it's like playing Russian roulette. And I'm really happy. My 3 adult kids have never had a problem with substances, even though it's genetic, right? The big lie is your problems in your life are because you inherited them from your mom and dad. Genes account for about 30% of the healthcare problems in our country. About 70% of them are because of your bad habits. Did I say that? The next scan, this is what OCD looks like, where the front part of the brain works too hard, so you can't stop thinking. And this is what bipolar disorder looks like, where there's too much activity in the brain. In 1992, I went to an all-day conference at the American Psychiatric Association's annual meeting, and there was a conference on SPECT in psychiatry. I was so excited. I'd been doing it for a year. I found it was so helpful for my patients. Why? Decreased stigma. They saw these problems as medical, not moral. Increased compliance, because they developed something I call brain envy. You see your brain and it's not looking so hot, you want it better, right? If you have any ego strength at all, you're like, well, how can I make that better? So they're more compliant with treatment. It helped families because now families saw these things as medical issues rather than he just has a bad attitude. And it helped me target treatment. So I had better rationale for what I would do with my patients. So I'm pretty excited, I'm pumped. I'm gonna meet other people that are doing it. There's a group from Creighton, they'd done 2,000 scans, and I've, maybe done a couple of hundred. I'm so excited. But there were researchers from NIH and Harvard, and they're like, oh no, you shouldn't do that. That's only for research. And I went up to like the famous guy from NIH who'd published some studies that, I'd idolized him. Subsequently, I've learned to whole stop the idolization thing, except for Jesus, right? And I'm like, oh, I just love your work. I said, we're doing it. It's like, oh, well, you're not supposed to do it. I'm like, well, why are you doing research if I'm not supposed to replicate it? If it's not to help patients, why are you doing it? And it's like, well, you shouldn't do it. In fact, I'm going to go to that conference where you're going to, I'm going to crash the party. And the idolized thing just totally went away. But I told you I'm a maverick, right? Tell me I shouldn't do something. I'm at least going to ask you why. And if you give me a bonehead answer like because you didn't say it was okay, even though I had a lot of experience, I just think you're not that smart. So I'm really clear. Without imaging, psychiatrists make diagnosis like we did in 1840 when Abraham Lincoln was depressed. Think about this with me. Lincoln had 2 major episodes of depression. And in the winter of 1840, he was suicidal. His friends actually took his knives from him. And he went to see his doctor, Anson Henry. And how did Dr. Henry diagnose him with a mental illness? He talked to him. He looked at him. He looked for symptom clusters. Then he made the diagnosis and put him on a treatment plan. Well, heck, isn't that what happens in 2014? I know a lot of people here have been diagnosed with psychiatric illnesses. Isn't that exactly what happened? They talked to you, they looked at you, they looked up the DSM-4, 3, 5, whatever version of the cookbook you had, and they go, oh, you have bipolar disorder. Oh, you have schizoaffective disorder. Oh, you have ADD, or you have major depression, or you're a panic disorder, you have OCD. You fit, except most people actually don't. Here you are, and many of you here have been given actually multiple different diagnoses. Right? I'm right about this, right? And then they decide what treatment is for you. That's crazy when you think about it. That's exactly what happened to Lincoln 174 years ago. Without imaging. I hate to say this, because some of my friends here are psychiatrists. We are the only medical specialty that virtually never looks at the organ it treats. Cardiologists look. Orthopedic doctors look. Neurologists look. Every other medical specialty looks. Psychiatrists guess. And that hurts people. There is a reason that most psychiatric medications have black box warnings. It's because they hurt people when you give them to the wrong thing. Now, I told you my heart is why I became a psychiatrist. It was clearly not for the money. It's in the bottom 3 professions of income in medicine. It was because I loved it. But here I am in a practice I love, and somebody would meet 6 out of the 9 criteria for major depression, and I would put them on Prozac. Some people would get better, and some people, all of a sudden, they want to kill somebody, or they want to kill themselves. And if you have that happen enough, pretty soon, as the physician, you feel off-center. It's like, I could hurt people if I don't do this right. And when you hurt a couple, it horrifies you. And now I have an imaging tool or I'm not doing that anymore. People are getting better faster. Next slide. So before imaging, I was throwing darts in the dark at people. Think about that. I often think of it as medicated, tipped darts in the dark. I can go. It's not working very well. 1980, so I decided to be a psychiatrist. And I tell my dad this. So if you knew my dad, he was a tough dad growing up. Very successful. But his favorite word, God, I know I'm in church, I can't say this. Actually, I'm in the refinery. His favorite word is bullshit. It's his favorite word. And I go, I want to be a psychiatrist. And he's like, what? Why don't you want to be a real doctor? And that was 34 years ago. And it hurt my feelings. But now I understood what he meant. It's because we often don't act like real doctors. It's not working very well. Slide, please. So our outcomes have not improved since the 1950s. It's psychiatry's dirty little secret. Antidepressants, when they get the published data and the unpublished data with the Freedom of Information Act, Irving Kirsch published a whole book on this called The Emperor's New Drugs, so that antidepressants work no better than placebo, except for the severely depressed. Now, I actually think he's wrong. I think when you target them right, they can be very powerful, but if you give everybody the same thing, they just don't work very well. Slide, please. Antipsychotics and stimulants, we have no more effective ones than the ones in 1950s. So we have no more effective antipsychotic than Thorazine, no more effective stimulant than Ritalin. It's like, this is a problem. Not looking at the brain hurts patients and families because symptom-based diagnoses are misleading. It leads to a one-size-fits-all treatment. Oh, you're depressed? Take an SSRI. And they actually don't work any better than placebo in large-scale studies. When you add the studies published by the drug companies and the studies that were not published, not looking at the brain, you completely miss important things. Traumatic brain injury, or brain toxicity, or brain infection. You miss that some psychiatric medicines, they're just flat out toxic. Brand new study just this week. If you're on a benzo, it doubles your risk of early death. Now, if you're on a benzo, don't just go home and stop it. You gotta be thoughtful in this. But as soon as I started doing scans on medications like Ativan and Xanax, I stopped prescribing them. Why? Because their brains look like my alcoholic brains. I'm like, no. What did they say in medical school? First, do no harm. Least toxic, most effective. I'm like, I paid attention in medical school. Mostly I was in the charter class at ORU, and there were only 16 of us, right? So you had to show up, and you had to learn this stuff. Next slide. Not looking at the brain hurts families because you miss a huge opportunity to decrease stigma and increase compliance. And I've been thinking about this a lot lately. What if mental health was really brain health? I hate the word mental illness, just hate it, right? Because it almost implies that it's not real. And those of you that live with mental illness or you have it in your family, you know it's real. And it's really hard. It's really painful. Next slide. Okay. Not looking at the brain, it hurts our society. Why? Because organizations like the NFL and the NHL, they were in denial for decades about the impact of traumatic brain injury on their players. It hurts military personnel. They've had hundreds of thousands of soldiers exposed to blast injuries, and they are not routinely imaging them. Isn't that just a little nuts when you think about it? 700,000 veterans are in jail. 22 veterans a day kill themselves. This is a scandal. But many of them have TBI or traumatic brain injury that is left undiagnosed. And if you don't diagnose it, then obviously you can't try to rehabilitate it. Costly dementias, they get not diagnosed until too late before you can do anything about it. Now, a lot of people are going to go, imaging is expensive. And I want you to think about that. Imaging is expensive. But whenever I prescribe a medicine, people go, what are the side effects? And I'll tell them the side effects. But then I'll also go, let's talk about the side effects of not being appropriately treated. And what are the side effects of having an inappropriately or an ineffectively functioning brain? So put the slides back up. So it's underachievement, school failure. Think of, I've put 3, 4, 5 children through college. And, some years you spend $60,000 a year to send them to college. Well, wouldn't you want to send them with a brain that actually worked right? And if it didn't work right in high school, don't send them away until it actually works right in a junior college. Because often the first breaks happen for kids that are not ready to go away, that get loaded with stress. So underachievement, school failure, job failure. What does it cost you to get fired or to not be effective at your job? Relationship problems, legal problems. How much do lawyers cost you? I mean, that's expensive. Failed therapy attempts, failed attempts at medication, residential. I've already talked to like 4 people today whose kids are in residential treatment. It's like up to $100,000 a year. Or drug treatment. It's very expensive. A day in the hospital is $2,000. The cost of an evaluation at our clinic, so the whole evaluation we do is about $3,700. And yes, it's expensive, but the cost of having an ineffectively treated brain is very expensive. Next slide. All right, big early lesson. So I'm looking at the scans and I'm like, oh, what's the pattern for ADD? It's already been published in 1990. And what I found is all ADD people weren't the same. I'm like, oh no. If I give them all stimulants, I'll help some and hurt others. Well, what about the pattern for depression or for anxiety or bipolar disorder, schizophrenia, or addictions? They weren't one thing in the brain. And so what I realized is this document we have called the DSM, it didn't categorize people. There weren't 7 types of ADD. There were 2, the hyperactive type or the inattentive type. There weren't 7 types of anxiety and depression. There were 1. There wasn't 7 types of bipolar disorder or schizophrenia. And I'm like, oh no. Now, there was a lot of imaging excitement in the early 90s from researchers. But unfortunately, because the imaging results didn't match the DSM, they thought, oh, imaging doesn't work. Now, I'm using it, and I see that it works, and I went, the cookbook's wrong. If you just use the cookbook, you're going to hurt people. So we should be looking. How the heck do I know what's going on in your brain unless I look? It reminds me of Johnny Carson. So you remember Johnny Carson? And Johnny Carson has this routine of Karnak the Magnificent. You remember the turban on it, and he takes the card and puts it up to his head, and it's like, the answer is. And I'm like, that's my profession. Now, you're beginning to see why maybe I'm not that popular among my colleagues. And if you knew me, you know I was sort of shy and a little bit anxious, and I sort of like it when people like me. So now I'm really in trouble, because whenever you say the emperor has no clothes, the emperor's got henchmen, and they're going to go after you. And I found myself in this very uncomfortable place of being attacked. And in 1996, I got investigated by the California Medical Board. It was a terrible year for me, because you work hard to get into medical school, right? I mean, you work your brains out. And then you're like being trained 4 years of medical school, 5 years of specialty training, and now I could lose it all because I believe in this so much. Now, at the end of the year, the investigator said, I think what you're doing is sort of cool. Maybe you should publish on your work. And we now have 60 publications. So here are two people with depression. One has really low activity in their brain. The other has really high activity. Do you think they will respond to the same treatment? No. Of course not. And how would you know which it is if you never looked? I have no idea, because I'm surprised all the time, and I've looked at tens of thousands of scans. So this is how we make diagnoses. Symptom equals diagnosis equals treatment. So if you're depressed, they give you a diagnosis with depression, and they have medicine for depression. Or if you're anxious, they'll give you an anxiety disorder diagnosis and then anxiety medicines. Or if you have attentional problems, they'll give you an attention deficit hyperactivity disorder diagnosis, and they'll give you a stimulant. Or my favorite thing to explain this is if you explode intermittently, you have temper problems. They actually give you a diagnosis called IED. Does anybody see the irony in this? Intermittent explosive disorder, like improvised explosive device. I just think it's hysterical. There's actually a diagnostic term called IED. So then what the heck do you do with that? This is crazy when you think about it. Next slide. So there's a better way. So what we do is we do a comprehensive assessment. You still have to talk to people. And then we image them. And so what we do is if you're depressed, we want to know what your brain looks like so we can take those two pieces of information, target treatment for you. And our outcomes are better than anyone who publishes outcomes. We published a study a couple of years ago that if you get a scan, it changes what your doctor will do 8 out of 10 times. We see brain injuries that nobody had thought about. We see toxicity or infections. We see, oh, I'm stimulating a brain that I really should calm down. And then recently we published an outcome study. So everybody who comes to Amen clinics, we study them. You know, we think of ourselves as clinical researchers. So everybody takes standard tests when they come in, and then we call them at 6 weeks, 3 months, and at 6 months, we do some of the standard assessments again. Now, know about our patients. We see complex people. On average, they have 4.2 diagnoses. They have failed 3.3 people, and anywhere from 4 to 6 medications. So we see treatment-resistant people. And at the end of 6 months, 75% of them are better across all measures. 85% their quality of life goes up. The Cleveland Clinic also reports its outcomes. And they say in almost 50% of their patients, their quality of life goes up. And we're like, yes. We're really excited about that because it's imaging-informed treatment. Now, we have some other things we do, like first do no harm. So we tend to start with natural things. We think diet is absolutely critical, that exercise is very important. We'll often start with natural supplements, and if they don't work, we'll keep pushing it. And we certainly will use medicine, but we find we use a heck of a lot less than our colleagues because it's informed by imaging, and oh, by the way, I totally have brain envy. We want to make your brain as healthy as it can be because, you know, when Pastor Warren's like Daniel Plan and physical health, the Daniel Plan is totally about mental health. So the next big lesson after most things are not one thing is that mild traumatic brain injury ruins people's lives and nobody knows about it. I didn't know about that. I would ask once, have you ever had a brain injury? And people would go, no, and then I'd leave it alone. But then I would see scans that look like this, and I'm like, do you ever have a brain injury? I don't think so. Have you ever fallen out of a tree, off a fence, dove into a shallow pool? And the first time this happened to me, it was hysterical. Because I'm in my office, I'm intense. And I'm like, scan's got a big dent, left front side of the brain. I'm like, did you ever have a brain injury? He says, no. Like, are you sure? Because there's not anything else that'll cause this pattern. He's like, I don't think so. Did you ever fall out of a tree, off a fence, dive into a shallow pool? Did you play sports? Have you been in a car accident? And all of a sudden, he's like, I was 7 years old. I fell out of a second-story window. Do you think that counts? Maybe. But the fact is, you can have a severe traumatic brain injury, have no recollection of it, because amnesia often happens after injuries, or when your parents were away and you had a babysitter at home who had her boyfriend over and she's paying no attention to you while she was changing you. She could have totally dropped you on your head, but because you have hair, as opposed to me, if I was dropped on my head, people would know about it, have a bruise, but nobody knows about it. So it's a major cause of psychiatric illness. Actually, the image on the screen, let's go back one. This is a 15-year-old boy who had failed 3 residential treatment programs for violence. They kept throwing him out of the programs, and when he got, I'm like, when did he have a brain injury? And the mother all of a sudden starts weeping, and she said, when he was 3 years old, he fell down a flight of stairs. I took him to the hospital. The doctor said he would be fine. He was unconscious for about a half an hour. Nobody had ever told her, if his behavior starts to change, we need to look at his brain. And CAT scans and MRIs, they're not good for traumatic brain injury because they're anatomy studies. Often the anatomy of your brain is just fine, or the structure of your brain is just fine. I mean, think of it. If I had a laptop and just took it and dropped it, well, it might look just fine. Actually, this happened last week at my house. The cat dropped the laptop, and it looked just fine, but you couldn't turn it on, right? So the structure was fine, but the function was terrible, right? So you need a functional study. So SPECT or PET or quantitative EEG are much more helpful in mental health. But what this boy needed was not more punishment. It was not more untargeted medication. It was a brain rehabilitation program. Undiagnosed brain injuries are a major cause of homelessness, drug and alcohol abuse, depression, panic attacks, ADHD, and suicide. It's one of the reasons we have 22 suicides a day. And if you never look at their brains, you will have no idea what percentage of them have been exposed to blast injuries or who've had another form of traumatic brain injury. Next slide. I'm going too fast. Infectious disease is another lesson that we learned, is a major cause of psychiatric illness, and nobody knows about it. Why? Because these people, they get depressed, and they see psychiatrists that get put on medications, and when the medications don't work, they get labeled as personality disorders. I am totally not a fan of that whole diagnostic category of personality disorders. What does that mean? It means your brain is troubled. If your personality is so bad, somebody labels you like that, it means something's going on in your brain. So here's an example. So here's Adriana, 16 years old, normal, until she goes to Yosemite on vacation. And when they get to their mountain cabin, they're surrounded by 6 deer. She thinks it's a magical moment. But 10 days later, she starts to hallucinate. She becomes aggressive. She's paranoid. They put her in Kaiser, in the psychiatric facility. They start putting her on Risperdal, Zyprexa, Abilify, Geodon, Seroquel. None of them work. She becomes like a ghost of herself. And then her mother heard me lecture and brought her to our clinic in Northern California, and her brain looked toxic. I'm like, why does a 16-year-old have a toxic-looking brain? That didn't make any sense to us, so we worked it up. You know, scans, sometimes they don't tell you the answer. They tell you you have to go find the answer. And it turned out Adriana had Lyme disease from a deer tick that she got from that, magical moment. And on an antibiotic over the next year, Adriana got her life back. And last year started as a freshman at Pepperdine in Malibu. And this year, she's out in Europe going to school. I mean, she's normal. Imagine if we would have taken her down the rabbit hole of psychiatric treatment. I mean, I think there's a whole bunch of people who have schizophrenia that have something else. And how would you ever know unless you looked? It's really easy to give them a label. It's really hard to go, why? Next slide. So, as we started to do our work in earnest, people started to come from all over the world to see us, and judges and defense attorneys sought our help to understand criminal behavior. This is the most controversial part of what I do. We have seen 500 convicted felons and about 90 murderers. And our work taught us that people who do bad things often have troubled brains. That was not a big surprise. What did surprise us was that many of those brains could be rehabilitated. Wow. Now that's a big idea. Next slide. We're missing. Okay. So here's the radical idea. In fact, I live in Orange County. We're a very conservative county. I think of this, you will think of this as a really liberal idea. I think of it as the most conservative idea you can have. So what if we evaluated and treated troubled brains, rather than simply warehousing them in toxic, stressful environments, where they feed them awful, and you get to hang out with other troubled people. You know, people are contagious. You become like the people you hang out with. So in our experience, we could save tremendous amounts of money by making people more functional so that they, when they got out, most people who go to prison get out, could work, support their families, and pay taxes. Tell me that's not a conservative idea. We're investing in our society. Dostoevsky, the famous Russian author, once said, "A society should be judged not by how it treats its outstanding citizens, but by how it treats its criminals." What would Jesus have done? It's actually clear what Jesus would have done. Instead of crime and punishment, I think it should be crime, evaluation, and treatment. Now, I already know it's not sitting well with some of you. You're like, he's just giving an excuse for people to be bad. It's like, no. When people's behavior is so out of whack, yes, totally could just be the choice of a bad person. But how would you know unless you looked, right? And if they have a perfectly fine brain, send them to jail forever. Right? People make bad decisions all the time. But if their brain is damaged, and so I end up getting involved in death penalty cases. And, you know, I'm in court, and people are going, Dr. Amen, this was actually a real case, death penalty case. The prosecutor read my book, Change Your Brain, Change Your Life. He said, Dr. Amen, I understand you're Catholic. I'm like, used to be Catholic. But he didn't even hear me. He had low frontal lobes. He's like, as a Catholic, don't you believe in evil? I'm like, you know, I think I do believe in evil. But I'd never call anybody evil unless I could scan them first. Next slide. All right, where are we? There we go. Could imaging have prevented Junior Seau's death? I absolutely believe it could have. In 1994, the NFL formed its concussion committee. Yet, by 2009, it had never sponsored a functional imaging study. Instead, they studied rats. They actually put little tiny helmets on rats, took 50 to 100 gram pellets, and whacked them in the head repeatedly. And they go, you know, we can't tell if this causes long-term brain damage. The commissioner was in front of Congress in October 2009 saying the NFL didn't know if playing football caused long-term brain damage. They were studying the issue. Maxine Waters, the congresswoman from Los Angeles, whacked him metaphorically and said, "Commissioner, having you study head trauma in football is a conflict of interest." It's sort of like the tobacco companies studying lung cancer. Stop lying. And the NFL was acting like many employers do: delay, deny, and hope they die. So, together with the Los Angeles chapter of the NFL Players Association, Amen Clinics performed the first large-scale study on active and retired NFL players. Next slide. Oh, the problem with the NFL's position? If you don't admit you have a problem, you can't do anything to solve it. So we put together this study, and what we found in 100 players, there was widespread damage in virtually all of their brains. They scored poorly cognitively. They had 4 times the level of depression that we see in the general population. They had problems with mood, temper, sleep, motivation, pain. Now, my real job is not as a researcher. I like getting people better. So what we did is we took this group, we put them on a multiple vitamin, high-dose fish oil, a brain boost supplement that I designed called Brain and Memory Power Boost. We then taught them how to eat and exercise. So I always felt stupid telling an NFL player to exercise. But brain healthy habits. After 2 months, 80% of our players showed cognitive improvement. So what that means is on a simple regimen, you can rehabilitate brain damage. So you've all heard about CTE and the problems in the NFL, and everybody's hopeless about the issue, and I'm like, well, why don't we scan and treat them? Why don't we try to make them better? We'll go with supplements, hyperbaric oxygen. If that doesn't work, we'll use medication, but it's going to be scan-guided treatment. So we're pretty excited about that. I think I have the study. Here's Duval Love, who's offensive guard for the Rams. His brain just looked awful. Here's our rehabilitation program. We published this study. We're really excited about rehabilitating brain trauma. And here's a before and after of one of our other players, significant improvement. Here's Duval Love's scan. Now, I don't really want his new brain, but it's a heck of a lot better than the old brain. Think of the hope there is. You are not stuck with the brain you have. You can make it better, and I can prove it. So our work helped to change the NFL's position. They are no longer lying about the issue. Now, they're not fully forthright because they're in this lawsuit. I mean, what business has half the people who've worked for it in the last 2 decades suing it? I mean, it's a little nuts when you think about it. There are 5,000 players suing the NFL, and they had this sort of nonsense $765 million lawsuit settlement. And I'm like, that's not enough. You know, so the judge said, that's not enough, because you need to give these people medical care for the rest of their lives. Next slide. But they have concussion posters in every major locker room in the NFL. So reversing brain damage. And I would argue that a very high percentage of mentally ill people have brains that aren't working right. And if we can optimize them, now, it may not make the schizophrenia go away, but it's going to increase your function. Just last Friday, I scanned an autistic boy, 18 years old. He's starting to have sort of more mood and behavioral issues, and the psychiatrist is starting to snow him with antipsychotics and anticonvulsants. And I'm like, why don't we look at his brain? And they brought him in. He had a very low activity brain. I mean, really, really low. And I'm sort of excited because I know if I increase the blood flow to his brain, supplements, hyperbaric oxygen, medicine, whatever I can do, transcranial magnetic stimulation, that I'm going to take him from an IQ of 40 to an IQ of maybe 65. Now, that's a huge difference when you understand it. I mean, yes, he may not be normal, But we're looking always for your best functioning. And sometimes, like a girl I saw, when I see Cappy, first time it was August. And she's cutting herself, she's suicidal, she'd just come out of a residential treatment facility, she hates herself, she has an IQ of 90, she's in a college prep school, and she hates herself every day of her life because she can't do it. And when we scanned her, we usually do 2 scans, one at rest, one when they concentrate. When she tried to concentrate, her brain shut down. It's a classic finding in ADD that no one had ever sort of thought about with her because she was a quiet kid, she was never hyperactive. And when I boosted her brain, she got straight A's the last 3 quarters. I mean, I'm so excited about this. And oh, by the way, she's not cutting herself, she's not trying to kill herself, she's singing, she's living. When your brain works right, you work right. When it's troubled, you have trouble in your life. Next slide. So, this is very much like Cappy's brain, before and after. Or one of my favorite stories. So I've been knocked around a little bit by the American Psychiatric Association. We don't really like each other. I'm a distinguished fellow of the American Psychiatric Association. It's the highest award they give members, but the people who voted on that committee were like the politically powerful ones, I suppose. And so in our journal, 2010, they actually attacked me. And they said there was no science behind what I did. Thankfully, I could reply. The first words are, "Do you read?" We have 2,900 scientific abstracts on amenclinics.com that underlie the science behind what we do. But the day I got attacked is important to this story. So show the picture. So this is Ray and Nancy. Ray is one of our football players. Ray joined my football study so that I would see his wife, Nancy. Nancy had been diagnosed with frontal temporal lobe dementia. That's wicked dementia, bad dementia that we have nothing that can help. And when I scanned Nancy, this was her scan, the front quarter of her brain was awful. And I told Ray, I said, I agree with the diagnosis. Ray was really unhappy because the doctor told him that he should find a home for Nancy because within a year, she would not know his name and be totally incapable of taking care of herself. And Ray was sad and he was mad. And I said, you know, I agree with the diagnosis, but if she was my wife, and I like my wife, who's here, say hi. If she was my wife, this is what I would do. Completely changed her diet. Got her to exercise. Put her on the same supplements I put our NFL guys on. Put her in a hyperbaric chamber. 10 weeks later, at about noon, I find out about the attack on me. And I'm furious. Because an ethical organization, if they're going to actually go after one of its own members, would let them know ahead of time and go, we're going to publish this on you. Do you want to respond? They didn't bother to do that. So I'm on the phone with the editor. I maybe said some colorful things to him. And I'm hurt. And then they walk into my clinic for her follow-up scan 10 weeks later. And this is what God has done for me every time. I get attacked. Another story comes to remind me you need to do this work because without looking, Nancy would have been in a home and now probably would be dead. It's 5 years later. Nancy still knows Ray's name. And oh, by the way, this is a great picture of Ray and Nancy. He dropped 30 pounds. And I'm like, how'd you do that? And he said, well, I just did everything you said. I knew if I lived it, she would too. So sometimes motivation is about love. Ray loved Nancy. Next slide. Come on, you can do it. Imaging and fighting for your brain goes way beyond mental health. There are 140 studies now that say as your weight goes up, the size and function of your brain goes down. That should scare the fat off anyone. That's why Pastor Warren called me to help with the Daniel plan, because he heard me say, big body, little tiny brain. You're going to become extinct if you don't get serious about this. So I went to another church here in Southern California and watched what they were serving, and I'm like, no way. And I prayed God would use me to change the culture of food at church. You know, the obesity epidemic started in the Bible Belt. Most people don't know that. And then Pastor Rick and Kay asked Tana and I to help create the Daniel Plan, which the first year, 15,000 people signed up. They lost 250,000 pounds. But that was only the side effect. People got off their medications, their blood pressure, blood sugar, sexual dysfunction, all were better. I mean, it's amazing. The Daniel Plan is just an awesome program to get well physically and mentally. It's based on 5 pillars. Faith. Why do you care? Food. Food is medicine or food is poison. Tana's actually written 6 books. And one of Tana's really great gifts, she knows how to take really healthy food and make it taste awesome. She is just so gifted that way. Fitness. Head-to-head. Zoloft versus exercise. They're equally effective at 12 weeks. At 10 months, exercise kicks the socks off Zoloft. So you should be exercising every day. Well, it's the simple thing. Walk like you're late. 45 minutes. Just walk like you're late. It's not that hard. It's cheap. Increases your metabolism, helps blood flow. You get a fatter brain, and you know, when it comes to the brain, size matters. Focus. That's the part that I have spearheaded. So it's about brain health and clear thinking. And friends, we get better together. The fastest way to get healthy, you want to get healthy? It's not to incarcerate people. That's the fastest way to make them sick. The fastest way to get healthy is to find the healthiest people you can stand and spend as much time around them as possible. Next slide. So God gave you a big brain for a reason, so you want to optimize it. And this war is personal. I'm going to close with this story. So, it's 1995. I have been roasted by my colleagues. He's a charlatan, a snake oil salesman. He's making money by taking advantage of sick people. At 1995, we didn't even own the imaging center. I was sending them away to another imaging. But, I mean, they were roasting me. And if you knew me, I'm sort of anxious, and I'd like people to like me. And so I'm in this terrible quandary. And God broke me out of it. I get a call late one night in April 1995 that my 9-year-old godson, Andrew, who's also my nephew, attacks a little girl on the baseball field for no particular reason. And I'm on the phone with Sherry, my sister-in-law, going, "Excuse me?" She said, "Danny, he's different. He's mean. He never smiles anymore. I went into his room today and I found 2 pictures that he had drawn. One of them, he's hanging from a tree. The other picture, he's shooting other children. Andrew is Columbine, Sandy Hook, Aurora, waiting to happen." And I'm like, I want to see him the next day. And they drove from Southern California to Northern California. That's where we had our first clinic. And I'm like, Andy, he's sitting on the couch in my office, and I love this child. I'm like, honey, what's going on? And he said, Uncle Danny, I'm mad all the time, and I don't know why. And I'm like, is anybody hurting you? He said, no. I said, is anybody teasing you? And he said, no. I said, is anybody touching you in places they shouldn't touch you? And he said, no. And my first thought is, you have to scan him. And then my next thought, because we always are talking to ourselves, is you want to scan everybody. Maybe it's because he's the second son in a Lebanese family. You're the second son in a Lebanese family. And then all of a sudden, the rational voice in my head said, stop it. 9-year-olds do not attack people for no reason. Scan him. If his scan is normal, then you can play the psychological game. And so I went with him and held his hand while he held his teddy bear and got scanned. And this is the picture that came up. Andrew was missing his left temporal lobe. And I looked to Dr. Paldi, my mentor, and I'm like, what the heck is that? And so his mother wouldn't hear. He writes down cyst, stroke, tumor. And we got an MRI that day, and he had a cyst the size of a golf ball occupying the space of his left temporal lobe. Now, I'd already correlated left temporal lobe issues to violence, and I called his pediatrician here in Orange, and I said, you find someone to take that out. And he's like, got it. 2 weeks later, he calls me back. He said, I talked to 3 neurologists. None of them said they would operate on him, that his cyst probably had nothing to do with his symptoms. I'm like, are you nuts? I said, tell me more about symptoms. They said, until he had real symptoms. So let me see if I got this right. I have a homicidal, suicidal boy. What are you waiting for? And he's anxious because I'm mad. And he's like, well, I think they mean seizures, or he loses consciousness, or he has speech problems. I'm like, are you nuts? And I called a friend of mine at Harvard who's a pediatric neurologist, and she told me the same thing. And I'll bet you today, she still hears me screaming at her. And then I think to myself, neurologists, neurosurgeons do things. And I called the pediatric neurosurgery department at UCLA, and I talked to a doctor by the name of Jorge Lazarev. And you'll know Dr. Lazarev. He's famous. He separated the Guatemalan twins who were connected at the heads, remember? Well, he was famous to me before then, because when I told him about Andrew, he said, I'll take it out. He said, whenever cysts are symptomatic, and he's obviously symptomatic, we'll take it out. And they did. And here is Andrew after the surgery. And after the surgery, I got 2 phone calls. One from his mother, who was so excited. She said the surgery went really well. And when Andrew woke up from surgery, he smiled at me. She said, Danny, he hadn't smiled for a year. The second call I got right away was from Dr. Lazarev, who said, oh my God, Dr. Amen. He said that cyst was so aggressive for Andrew. It put so much pressure on his brain that it actually thinned the bone over his left temporal lobe, that his temporal bone was eggshell thin, and that if he would have been hit in the head with a ball, he'd been killed instantly. Either way, he would have died in 6 months. And it was at that moment I lost my anxiety about imaging. How do you know if you don't look? 999 psychiatrists out of 1,000 would have medicated him and or put him in psychotherapy. They wouldn't have looked at his brain. And a year later, Andy and I, and now I'm passionate, I'm on fire. You can't shut me up. And a year later, we're snorkeling together in Hawaii. And, Andy's got these big, brown, beautiful curls. And after we get out of the water, we're having something to drink together. And he looks at me with his beautiful brown eyes. And he said, Uncle Danny, we're a spiritual family. He said, why did that happen to me? I went, oh no, because I knew why it happened to him, so that I wouldn't be afraid anymore, so that we could do this work and change this very stuck profession to help real hurting people, because that's really always been the goal. How do you know unless you look? If you don't look, you hurt people, and that's not fair. That's not science. That's not medicine. It's stupidity. We can do better. So when I think of the single most important lesson I've learned from 87,000 scans is you can literally change people's brains. And when you do, you change their lives. But if you don't look, you hurt people. And that's not fair. Thank you. Thank you. I think maybe we have time for just a few questions. Go to the microphone if you do. There are 2 microphones, one on either side.
So if someone recently had a moderate concussion and they had amnesia for 5 weeks, they're better, they're still sleeping a lot, they had a CAT scan, an MRI, what would you recommend now?
Well, if someone had a concussion and their CAT scan and MRI are normal, which is very, very, very common, I'd get a SPECT scan. Because, one, it's a functional study. It's based on a very large database. And then it can target treatment to help them get better. Now, there are other studies. There's studies called quantitative EEG and PET. I'm a fan of both of them. I just happen to be a real fan of the one we do for a lot of practical reasons.
Thank you.
Yes?
I have Asperger's syndrome, and I was wondering, how can that be improved in the areas that we seem to lack function as other people?
So Asperger's syndrome, and you can just see the stupidity of the DSM. They gave you Asperger's syndrome in the DSM-4, and now they took it away in DSM-5, which is like seriously stupid. What we see is often the frontal lobes work too hard, and your cerebellum doesn't work hard enough. And so there's the area of processing can be hard for you. So once we know what's going on in your brain, we can then target the treatment for it. But not all Asperger's is the same thing, like not all depression is the same thing, like not all bipolar or schizophrenia is the same thing. So knowing what's going on in your specific brain can be really helpful.
When you say hard, do you mean hot in the area?
It means active.
Active?
Like, so we're looking at blood flow maps. It's like there's too much blood flow and activity. Actually, activity is probably a better term to think of. There's too much activity in certain parts of the brain, too little in other parts.
Okay, thank you.
Yes?
There's one more
Hi,
question.
Is that the voice of God?
Yes. Just one more.
Yes. Oh my goodness. So for everybody who's in line, I'm going to stay and answer questions, but for the tape, one more question.
I had a concussion when I was in about 5th grade from hitting the inside of the pool, diving in. And then I turned to drugs and alcohol, and I am basically a Skid Row heroin addict, and I've been off drugs since 2001.
Congratulations.
Thank you. And I just recently, I'm a health coach as well now, and I recently heard Dr. Wayne Anderson speak at a convention that said that 85% of all Americans are on some sort of mood-altering medication. And I thought, oh my goodness, I'm taking Wellbutrin and Ritalin. So I tried to get off of both of those, and I'm actually happier without the Wellbutrin. And I was almost all the way off my Ritalin, and I just totally lost it. I see my psychiatrist on Tuesday. Would you recommend that I get a scan from her, or what would you recommend at this point?
Well, so what did you tell me? You told me that, no, hang on,
Okay.
hang on. That you had a brain injury, so that hurt your brain. That you did drugs and alcohol, seriously. Obviously, not that good for your brain. Being on a brain rehabilitation program is really important. Now, I want everyone to hear me clearly. Please don't go home and stop your medication. That's irresponsible. But I want you to learn more about what you have, put brain optimization strategies in your life, and then together with a healthcare partner, if you're on medications, you can begin to either slowly go off of them. I'm not opposed to medicine, okay? What I'm opposed to is the indiscriminate use of medicine, and they're going after, here, take medicine first before they ever do any of the natural things that have good research that say that work. And so if you're better off the Wellbutrin, thank God. If you're worse off the Ritalin, well, maybe that's something that you need. It's not, you know, when I died, the girl, Cappy, I talked about, who was cutting herself, suicidal, failing, now straight A's. You know, Adderall's part of her treatment plan, and she and I talk about it. It's like glasses for people who can't see. That withholding, and a lot of parents, oh, I'd never put my child on medication. It's like, well, what's the matter with you, right? We use medicine for all sorts of things. The problem is we're throwing medicine at people in the dark. When it's targeted, it can be very effective. You would never, ever think of withholding glasses from a child who can't see, right? I mean, that's a brain intervention, glasses. So the medication prescribed properly can dramatically save your life. Okay, we got to stop, but I'll stay around and answer questions. Thank you so much.